a story of the past, a story of those Egyptians who created and made this wonderful structure.
Hawass exhumed the corpses of 20 workers and sent the skeletons to a nearby lab where the bones were examined and x-rayed. As one might expect, the x-rays revealed that many of the workers had suffered injuries. The big surprise was that many of those injuries had been treated with very effective medical procedures. There is evidence of broken arms healing after being set in splints. The end of this leg bone is well healed, proof that the worker received good care and lived for years after the surgical amputation of his lower leg. One set of x-rays and bones reveals evidence of the first known brain surgery in history.
This skull is for a man that's suffering from a cancer, which sent metastasis to the bone and can see it in this lesion. And there are evidence that they may try to make some surgical operation that appeared from this chiseling effect on the bone outside.
In 2500 BCE, Egyptian doctors chiseled a hole in this skull to relieve the pressure caused by the patient's brain tumor. Dr. Hawass argues not only is this a testimony to ancient Egyptian medical practices, but it may be additional evidence that the pyramids were not built by slaves. The traditional theory is that 100,000 slaves labored for 40 years to build each of the Great Pyramids. But Hawass has found documents in the workers' village that proves the workers were paid. The documents and the workers' bones lead Hawass to conclude that each pyramid was built in about 20 years by 20,000 Egyptian workers. The workers were motivated by nationalism and had the benefit of emergency medical treatment.
One important evidence also that the workmen were not slaves is the examination of the bones. If they were slaves, they would never do a brain surgery.
As the builder of the first pyramid, Imhotep may have treated injuries suffered by workers and presided over the world's first trauma center. Hippocrates, the Greek who was recognized as the father of modern medicine, lived in the 4th century BCE. But there is evidence that Imhotep, 2,000 years before Hippocrates, was practicing modern medical techniques. Dr. Hamdi El-Rafey, a physician and professor of ancient Egyptian medicine at the American University in Cairo, believes Imhotep may have authored the world's first medical treatise. Here, in a Cairo marketplace, Dr. Hamdi is using an ancient Egyptian manuscript to search for ingredients Imhotep may have prescribed. Ancient Egyptian medicine contained large doses of magic, but many of the treatments were scientifically valid and effective. Chief among them was the widespread use of honey as an ingredient in the dressing used to treat wounds.
Honey is an absolutely marvelous ingredient because honey is bactericidal and bacteriostatic, which means that bacteria cannot grow and are killed by honey. So you can imagine the effect of that on wounds. Put honey on any wound today, and I can guarantee it will not become infected. Honey kills bacteria.
Dr. Hamdi discovered the healing power of honey in an ancient Egyptian medical treatise that may be based on Imhotep's writings. The Edwin Smith Papyrus, named after its first owner, is the oldest and most important medical papyrus ever found. Dating from 1550 BCE, the document lists 48 traumatic injury cases and their treatments. the world's first known use of sutures to close wounds, moldy bread to cure infection, and raw meat to stop bleeding. The papyrus begins with injuries to the head and then works its way down the body. The same organizational structure used by Gray's Anatomy today.
The Edwin Smith papyrus is a very scientific papyrus in the sense that it presents a case as we would present it today to our medical students. It has a title, what to do about it, how to diagnose it, how to treat it, and how to do a follow-up.